I want to go ahead and do a little bit more challenging one, a select all that apply, which I know is everyone's favorite. But we're just going to take it line by line, like a true or false. So the nurse is caring for 5 clients on a telemetry unit. Which of the following client needs can the nurse delegate to a UAP? So once again, we're talking UAP. So the first one, determining the pain level for a client that just received IV morphine. Just received. Do we want to delegate this to a UAP? Yes or no? Determining the pain level for a client that just received IV morphine. I do not like the idea of delegating this. Just like Linda, Winnie, I agree with all of you guys. Or false. Sorry, Dee Dee. Here I said we were going to treat it like a true false. False. Determining the pain level for a client that just received a pain medication is evaluating their care and kind of doing an assessment. So that is once again a tape task that we are not going to delegate to a UAP. Option 2, assessing a client's ability to swallow food prior to feeding them lunch. So this one is a very, it's easy in my opinion only because the word is assessing. Right away it tells you that's a tape task, that's assessment, we're not going to delegate that. But also, if we're checking if a client can swallow food before feeding them, that is certainly something that we don't want to delegate, because if that client does have dysphagia or difficulty swallowing, we can cause them to aspirate and have a lot of complications. So no. I agree with you guys. Option 3, assisting a client admitted with pancreatitis to ambulate to the restroom. So remember, pancreatitis is just inflammation of the pancreas. You typically have some nausea, vomiting, you can have dehydration. Manu, you said what's TAPE? TAPE is those steps of the nursing process we're not going to delegate. So that is going to be teaching, assessment, planning, and evaluation. So I see a lot of yeses for option 3, and I agree with you. There is nothing in that option that indicates that that client is unstable. So it's just a routine task to help somebody ambulate to the restroom. So I love it. Option 4, assisting a client admitted with a myocardial infarction to perform oral hygiene. So a client with MI to perform oral hygiene. Do we like that? What do you think? And this is where I'm going to give you another helpful NCLEX tip. Don't overread, okay? Don't read into the question. I used to do that as a student. It's very easy to do, but don't do it. Because you could say, oh, myocardial infarction, that's a serious diagnosis. Maybe they're unstable. No, we're not going to go down that rabbit hole. We are going to just look at what they tell us. So I agree with you guys. That is a routine task, oral hygiene, on a client that is stable based on the information we have. Option 5, performing pericare on a client with an indwelling urinary catheter. Yes or no, or true or false? Do we want to delegate this? Yes, I agree that that is perfectly fine. Pericare is a routine task, and I know the client has an indwelling urinary catheter, but there is nothing to indicate they are unstable. So I think that is safe. But let me give you an example of when that would be inappropriate to delegate. Maybe it says perform pericare on a client with an indwelling urinary catheter with blood at the urinary meatus, or maybe they have bladder distension. Those are all indications that our client is unstable, and we would not want to delegate that. So option 6, recording the intake and output of a client with a history of CHF. Do we want to delegate collecting intake and output of a client with CHF? What do you guys think? So I think that is also a good option, just like you guys, because once again, intake and output is a routine task, and based on the information we have, this client appears stable. So let me give you another example of when this would be inappropriate. Maybe we have recording the intake and output of a client with a history of CHF with pink frothy sputum, or with crackles, or edema that's 4+. All those are indicators that the client might be in fluid volume overload or have pulmonary edema and would not be considered stable. But once again, we're not reading into things, so I agree with you. And then last one, this one kind of tricks people up a little bit. Performing vital signs on a client that just returned from the cardiac cath unit, to the cath lab. What do we think? Do we want to delegate this? Because a lot of times people see vital signs, and that's one of the most common tasks that's delegated. So they see that word, vital signs, and they just want to say yes. But y'all are on the right track. Lindy, Manu, Winnie, great job. No, because once again, as we said on the previous question, just returned or newly admitted or newly arrived, all of those tell us that that patient is unstable. And we are never delegating on an unstable client. So options 3, 4, 5, and 6, and we got them correct.